Well, the Pfizer vaccine, as you know, needs to be stored at -70. There is a very good program under the government's COVID-19 vaccine national rollout strategy that will see this vaccine delivered to rural and remote Australia. The phase 1A of the vaccine rollout is designed to target healthcare workers and those on the front line. So that is people working in emergency care, people working in aged care, and also aged care residents, and disability care as well. The Pfizer vaccine does last for 5 days under normal storage conditions. So through these 40 Pfizer vaccine hubs across the country, they will be logistic and distribution centres for the Pfizer vaccine in phase 1A of the rollout. So that means, rural and remote clinicians, aged care workers and aged care residents should be getting the vaccine through that process.
Yeah, okay. So there are, as you've just laid out, some logistical issues, but they're not insurmountable. Is there a situation where in some regional and rural areas that doctors might go to patients rather than patients go to them? You know, could you envisage a kind of door-to-door vaccine situation?
Look, this is certainly going to be the case in phase 1A. We've been given reassurances from government, from the Department of Health federally, that there will be teams that go out from these Pfizer hubs and vaccinate healthcare workers and aged care workers in the first tranche. In phase 1B, which is a different vaccine, it's the AstraZeneca vaccine, which can be stored under normal storage conditions. It'll be delivered very similarly to like the flu vax through GP clinics primarily. We certainly know that because of the logistic problems with the Pfizer vaccine, there is a concern that some states could drop the ball on this and not actually deliver in the same way to rural and remote clinicians and rural and remote aged care and aged care residents in the way that the government's intending.
Okay, so the other issue here is how this actually gets distributed. Are there any regional centres or regional towns that should be on the priority list first?
Look, this is a real issue. The states have been given freedom to choose the sites for their COVID-19 Pfizer hubs. Some of the states have done a great job in making sure that they've included some regional centres. Other states have sort of kept the Pfizer hubs in large rural and large regional and metro areas. And in some cases, the distances between those hubs is significant. To me, that means that in those states where they haven't dispersed the Pfizer hubs into the regions more broadly, there will be significant issues, and there may well need to be, flying squads or choppers taking the vaccine out to rural and remote areas from those hubs. At this stage, we're keeping a really close eye on this. It'd be completely unacceptable if rural Australia is left behind in the rollout. We've got brave healthcare workers on the front line that are dealing with suspect COVID cases, that are testing for COVID every day in rural Australia, and they should be given the same opportunity to get vaccinated early as the rest of the country.
Yep, absolutely. But is there an expectation? Do you think it's reasonable to expect some of those people in the regions to have to travel some distance to get a vaccine, keeping in mind that those that need it the most are the elderly?
Yeah, look, no. So with phase 1B, which is the AstraZeneca vaccine, it will be delivered to all general practices that have expressed an interest in being vaccine providers. And we know a large proportion of general practices in Australia have put their hand up, and they're going through a process right now to make them ready, which includes training. There's a process where the government's ensuring that individual GP sites actually have the capacity in terms of staff and fridge and equipment and built environment to make sure that they can deliver the vaccine. So the AstraZeneca vaccine will be readily available in any community where there's a general practice, and people will be able to access it through there. And we're calling on the community to make sure they do get out there and get vaccinated. And the best way to find out more would be to contact their local general practice.
Now, is there anything you know that we don't? Do you have a date yet?
So we've been told that the Pfizer vaccine will roll out late February, and that the AstraZeneca vaccine, we're looking at mid-March. They've pushed that date back a couple of times already. Obviously, there's significant issues globally with serious COVID-19 situations in the Northern Hemisphere. So it really depends on the manufacturing and the logistics and the transfer from where it's being manufactured to Australia. So I guess there's still some doubt about the certainty of particularly the AstraZeneca vaccine getting to Australia.